Atrial fibrillation, or AFib, affects more than 1 million Americans. It's the most common form of heart arrhythmia and can greatly increase the risk of stroke.
And as John Hansen explains in tonight's HealthCast, now doctors are using a minimally invasive procedure known as the ring and sling to treat the heart.
Bob Hundevat is a man on the move. As director of security for the Miami Heat, he covers a lot of ground. But last year, right before playoffs, he had what he thought was a cold that just wouldn't go away.
Really, it got to the point where I dreaded nighttime, going to bed.
Bob's symptoms were due to a heart that was out of rhythm. In addition, his mitral valve wasn't closing properly and blood was leaking back into his lungs. He dreaded the thought of heart surgery like his father had.
Basically, just cut the sternum all the way up and then wired it together.
Instead, Bob had the option of a minimally invasive procedure pioneered by Dr. Joseph Lamelas called ring and sling. Dr. Lamelas makes a 2-inch incision between the ribs on a patient's right side and then, using special instruments, gains access to the area near the heart to insert the ring.
When patients have a significant leak in the mitral valve, what the ring does, it brings the valve back to its normal dimension.
Dr. Lamelas and his team also insert a tube or a sling.
What the sling does, it goes inside the heart around that suspensory mechanism of the heart or the valve, and it brings it together.
The ring and sling allowed Bob's heart to quickly return to normal shape, getting him back to the World Championship winning team that he loves without missing a beat. I'm John Hansen, KFDX 3 News.
Now, Dr. Lamelas says the ring and sling procedure would work for most patients with weak heart muscles and a severe leak in their valve.
And while a few other surgeons across the country perform the ring and sling procedure, Dr. Lamelas is the first to make it minimally invasive.
Now, to learn more about this procedure, you can visit this story over on our webpage. Go to the HealthCast link at TexomasHomepage.com. We'll be right back with another look at your forecast.
Stay with us.
He's there at the heart of the story. When lives change, he's there to listen when it really matters.
Tough 24 hours.